welcome back to my YouTube channel. I'm still your favorite girl, Prominent. Thank you for your consistency. Thank you for watching. Thank you for commenting. Thank you for liking. Thank you for sharing. And thank you for subscribing. I do not deserve your time. I do not deserve your subscription, but you keep returning back. So on today's episode, we will be talking about first aid kits, those things you need to have in the house as an emergency kit. That is a must-have medical supply for your home emergency kits. We all know that most times we bring our children or even ourselves to the hospital as an emergency. There is no form of first aid. So the first thing on my list will be a thermometer. We all know that this temperature does not spike until in the night. You are helpless. You want to rush the child to the hospital, or you want to rush the adult to the hospital, especially when it's children. What you can do is immediately check the temperature. If the temperature is above 37 degrees, then you should immediately table sponge the child or run water on the child, not cold water, lukewarm water. Run it on the child. Then if you have paracetamol, you must have, so paracetamol should be your second thing you should have. Immediately give that child paracetamol. You already know the measurement of the paracetamol you should give prior to when you've been going to the hospital. So give that child paracetamol. Then you can now bring the child immediately to the hospital. Vice versa when it comes to an adult. The third thing rather, you should have plaster, you should have bandage, you should have spirit, you should have cotton wool, you should have inhaler, you should even have cough medicine. I would say you should have antibiotics, but that is if you have left over from the one you got from the hospital. I will not say you should have malaria drug, because except that malaria drug has been the one that has been prescribed to you in the hospital. But you should not self-treat yourself. Make sure you go to the hospital, run some tests, let the doctor prescribe for you. You can have cough syrup, and that is because you already know the kind of cough syrup you have been given before now in the hospital. You should have iodine. The kind of iodine you should have is that tube one that you can just press and rub on the site of the injury. Then you should have gloves, hand gloves. When you want to rub or apply any medication to an open injury, what you should do first is put on your hand gloves. Do not use your bare hands, because you will be infecting that wound. So use your hand gloves, then rub if it's bleeding, stop the bleeding by just putting cotton wool into spirit. Use it to clean the surface, to disinfect it, then put your povidone iodine. You can now take the person to the hospital. If it's in the case of heavy bleeding, maybe a cut with knife in the kitchen or something, and the blood is gushing out, do not panic. Take a deep breath, rest. Then make sure you put pressure on that site. If it's like a cut, use bandage. That's why I say have bandage, have gauze. Then immediately just use gauze and put on it, then hold it. Put pressure. When you put pressure, the blood will start subsiding. If it's maybe a fracture on the leg, what you can just do is immediately find a way to either call your doctor so you know what to do. Here is not where I can give you lectures of how you can start carrying a patient when it comes to those kind of emergency. Then inhaler. If you have anybody who is asthmatic in your house, you shouldn't even have one inhaler. I know with the way Nigeria is, you cannot afford to buy multiple, but if you can afford it, have 2 inhalers. One with the person that is asthmatic, and one with you, one that you know is reachable in case one person cannot find their own inhaler. one person with your next person will know where they kept their own. Then you can now bring the person to the hospital. If the inhaler is not stabilizing, they cannot give the person nebulizer. Make sure you have these things. I've seen parents who do not have thermometer in their house. You shouldn't do that. You should have thermometer. It's very important. You should have paracetamol. It's also very essential. Either tablet or syrup, depending on the age of the children you have. Then cough syrup in case of if your child is coughing excessively in the night. I hope I've been able to educate you and have not confused you the more. But these are the things you should have. On that note, I would like to thank you for joining me today. Please do well to like, to subscribe, and comment. You can also tell me how first aid have saved you at home, and we will see in our next video. Have a nice day. Bye.